So let's look for the T1 flare appearance. So in case of T1, then normally the CSF is dark. So, but in case of T2 sequence, the CSF would be bright. But when we go for the T2 flare, the signal is cancelled from the fluid. So the CSF will appear as dark in case of T2 flare. So both in T1 and both in flare, the CSF would be dark. And the CSF would be bright in which condition?
T2.
Yes, it should be bright in case of T2. And with respect to the fat should be bright in which sequence, and it should be dark in which sequence?
Both in T1 and T2.
So in
But
T1,
bright.
T2, as well as in case of flare, in all the three conditions, the fat would be bright. T1, T2, and flare, in all the three conditions, the fat would be bright. The only exception is the star pattern. So let's go for the star pattern. So star means the short tau inversion recovery. In case of star, we remove the signal from the fat. So the fat will appear as dark and the CSF will appear as bright. So in case of flare, we cancel the signal from the fluid. So the fluid or CSF, they will appear as dark in case of flare. And in case of star pattern, we remove the signal from the fat. So the fat will appear as dark. So the star sequence is completely opposite to which sequence?
Flare.
T2.
Try again. Not T2, not flare. In case of flare, the fat would be bright. So I was saying
T1.
yes,
T1.
very good. So in case of T1, the fat would be bright and the CSF or fluid would be dark. But in case of star, the fat is dark, the CSF or fluid is bright. So T1 and the star pattern, both of them are completely opposite. So the star images are highly water sensitive. So water or CSF will appear as bright, and this water or CSF would be dark in case of T1. So next one is the flare appearance of the brain as well as the star image. So in case of flare, we are cancelling signal from the fluid. So CSF will appear as dark and the fat would be bright. And in case of star pattern, we are cancelling the signal from the fat. So fat will appear as dark and the CSF will appear as bright. So is it clear for everyone? The T1, T2, the overall overview, the colors. Is it clear for everyone?
Yes, sir.
Okay.
To an extent, that's clear.
Okay. So which type of sequence is this?
Flare.
Why not this is T1?
Because fat is not bright here. Fat is also dark.
Yes, very good. And this one?
It's a stir.
Yes,
Because
this is the star
fluid is
pattern.
black, fat is white.
Yes, very good. So the fluid is appearing, the CSF is appearing as bright. This and the fat is appearing as dark, which is completely opposite to the T1. In case of T1, the CSF would be dark, the fat would be bright. So this is completely reversal of the T1. So this is the star pattern. So next, most probably this is another link from the Radiopedia with respect to the terminologies. So you already know the basic terms, the planes. Okay, so we have the coronal plane. We have the coronal plane. Coronal plane is also known as the frontal plane. So if we cut across the ear, or in Bangladesh is also known as if we cut along the কান বরাবর কাটলে যেটা সেটাই হচ্ছে coronal plane. So in case of coronal plane, if we cut across the ears, so dividing the patient into anterior and posteriorly, if we divide the patient into anterior and posterior segment, cutting through the ears, this is known as the coronal plane or frontal plane. Or also you can remember during the coronavirus attack or during the COVID, so we used to wear mask in the anterior portion of our face. So the COVID or coronal or frontal plane, it will differentiate into anterior and the posterior segment. So the coronal plane is a vertical plane perpendicular to the median plane, and it divides the body into anterior and the posterior part. So this coronal plane, this is also known as the frontal plane. Then we have the horizontal plane, also known as the axial plane or transverse plane, also known as the transaxial plane. So if we cut across the